Amen. Thank you again, everyone, for joining us. It looks like we have about 187 people that have joined on, and more are joining by the second. So we are going to proceed with this presentation. Oops, sorry about that. Again, we are just so excited about Pathway Phoenix, which is now just 3.5 weeks away. This is a picture of our volunteers there in San Antonio in the prelude to the San Antonio event, which was a very, very exciting kickoff. And Phoenix is going to be, I believe, much bigger and more organized. Every event we do, by God's grace, we learn a lot more. So as we all know, December 24 is set up, 25, 26, and half a day of the 27th at the Phoenix Convention Center is Pathway to Health Phoenix. Now, before we get into a lot of nuts and bolts, I just want to give everybody a few miracle updates. You know, from the beginning of Pathway, those of us in administration have said that there are 3 things, well, actually 4 things that I believe that have brought together Pathway. The reasons I believe that the Lord is blessing so much. It's trust in Him, complete, entire trust in Him, dependence upon Him. Trust, pray, earnest prayer, obeying what He's given, which is the great gospel commission, and uniting, all of us working together, regardless of our background, regardless of our specific benefits that God and gifts that God's given us, all of us working together to bring about His purpose, which is to share His love with the whole world. So I'm going to emphasize trust here. This is a picture of the Congolese government. Just to the right of me, looking at the picture, just to the right of me is the assistant to the president of the Democratic Republic of Congo. Just to my left is the Minister of Health to the Democratic Republic of Congo. Next to him is the lady. She is the Minister of Social Services. Following her is the assistant to the Minister of Health. And the last gentleman on the end is one of the leading evangelical pastors for the Congolese. Now, as you've heard several times over, Pathway to Health Phoenix is exciting and new in many different ways. In addition to our usual thrust for those, again, who are uninsured, underinsured, etc., we're having a huge emphasis with our refugee ministries. Our refugee ministries throughout North America are working together, particularly here in the state of Arizona, to reach into thousands upon thousands of individuals from various countries to help to provide not only them physical, mental, emotional services, and most importantly, spiritual services, but also to their family members, the family members of the refugees back in their own home countries. So let me tell you a very short story. Trusting in Jesus. Jesus says, go into all the world and preach the gospel to all creation. He told us to do that back when He was on earth. And Pathway, those of us participating, all of us have the opportunity of fulfilling, trusting in His promise, and then going out and obeying that promise. So a while back, it was several months ago, I felt impressed to pursue in this direction as far as the refugees are concerned. And we decided, a group of us, to have a simultaneous event. 2 Pathway events, if you will, one taking place in the actual country of Congo through God's providence, and one taking place simultaneously right here at Pathway Phoenix, downtown at the Phoenix Convention Center. How that was going to take place, none of us knew. Through God's providence, step by step, Dr. Lewin Williams and a pastor from Congo working together, put together a team that will be in Congo on Christmas Day, December 25, 26, and 27, providing services, it just so happens in God's providence, to the very city where most of the refugees from Phoenix are from. Well, about 2 weeks ago, I got an email and a call from one of the leading Seventh-day Adventist pastors for the Refugee Ministries of North American Division, and he said, you know, the Minister of Health and many other dignitaries from Congo are here, and they want to meet with you in Phoenix. They happen to be here visiting the refugees from their country, and they'd like to meet with you about the event that's taking place in their country. Well, by God's grace, I had the opportunity of meeting these wonderful people, and they were so excited and so grateful what the Seventh-day Adventist Church is doing, not only for the refugees here in Phoenix, but for what is taking place in their own home country. That they said, you know what, through translation, of course, they said, you know what, Dr. Leela, they said, we're not just going to stand by and say thank you so much. Any problems you have with customs, with visas, you have nothing to worry about. I went on to ask them about Adventist World Radio. You see, we're partnering. Pathway Phoenix is partnering with Adventist World Radio. to make this a global effect of whole person care, physical, mental, emotional, and spiritual healing to the world. And so I said, you know, they have something called God Pods, which are shortwave radios. Would you be able to help us distribute those to the family members of the Congolese refugees here in Phoenix, back in their own home country in Congo? And the government officials said, yes, absolutely. So the government of Congo is going to be helping to distribute God Pods in the local languages for the people that will continue to teach them simple physical, mental, emotional, and spiritual healing on an ongoing basis. So trusting God's promise to go into all the world and preach the gospel to all creation is such a beautiful thing. And none of this would have happened had it not been for great prayer, earnest prayer. Now, many of you will remember a month ago at our last webinar training, we all said, you know, we're having problems as far as the food service is concerned. We don't know if we're going to be able to feed the volunteers and the patients a noontime lunch because of the problems we're having at the convention center and exclusive rights. They had exclusive rights. They would not allow us to bring in any outside food without charging us an enormous amount of money. Well, after 8 to 9 months, it might even be 10 months of working with the city, working with the various dignitaries, working with many, many different people, every door was slamming shut until a man by the name of Dr. Troy Anderson. Dr. Anderson, I just want to give a shout and praise to God for you. Dr. Anderson connected me with several of his very influential friends. Mr. Don Mellon. Mr. Mellon owns almost nearly all of the McDonald's franchises in the state of Arizona. Mr. Mellon heard what the Seventh-day Adventist Church through Pathway to Health event was planning to do for his city, and he got very excited. And so he found out about the problems we were having at the Phoenix Convention Center as far as the food, and he immediately started making phone calls to many of his friends. One of those was Mr. Joe Pruitt. Mr. Pruitt used to be the former president of the Rotary 100 Club. Mr. Pruitt, too, an amazing, wonderful businessman, wonderful Christian man. Both of these men are just genuinely kind, loving Christian men. Went to the bandwagon, began calling every politician and various dignitary throughout the state of Arizona. Previously had the opportunity of meeting with both the governor's office and the mayor himself. And it took these gentlemen to really, God used these gentlemen as modern day Daniels to move his amazing arm, and God moved that arm, and we were able, through Mr. Milton Donaghy, the city manager for the Phoenix metropolitan area, for the city of Phoenix. Mr. Donaghy called me just this last Tuesday night. This is hot off the press stuff, guys. Just this last Tuesday night, Mr. Donaghy called me, the city manager for Phoenix, and he said, Dr. Leela, I want to tell you, we have waived, as the city, we have waived the requirements that you cannot bring in any outside food. We are going to let your volunteers prepare it. However, we are going to require that you hire some of the employees there at the Phoenix Convention Center to oversee your work. I said, Mr. Donaghy, I said, we don't have the money for that. I'm sure it's going to cost time and a half for these volunteers. We just don't have the budget for it. Right now, we have a budget for $2.36 per person, and I want to be able to provide the evening meal to the patients as well. Mr. Donaghy said, let me get back to you. First thing the next morning, this was Thanksgiving Eve, Wednesday morning, Mr. Donaghy calls me back and he said, Dr. Leela, I want to tell you, it's going to cost $17,000 to hire the Arizona Convention Center employee food service people. I said, oh, Mr. Donaghy, we don't have that money. He said, don't worry. He said, I spent last night calling all of my contacts and fellow donors, etc., personal donors. He said, we cannot waive that cost to you, but my personal friends and donors have raised the $17,000 to donate to Pathway so that Pathway can pay the convention center and you can provide the meals to both your volunteers and your patients for the noontime meal. What a blessing. What an unbelievable miracle from God. I had tingles going up and down my spine. It was such an unbelievable miracle. You see, when we trust God, when we depend upon Him, when we pray, and when we obey that God does not show favoritism. He accepts everyone who fears Him. It doesn't matter what country you're from, and does what is right. God is no respecter of persons. What an awesome opportunity, because when we trust, we pray, and we obey, God moves that mighty arm, and we see miracles at the last minute, not necessarily our timing, but at the last minute, he fulfills his promise to give this gospel message of love to the whole world. I want to introduce you to Pastor Gerald Babinazad. This is Pastor Babinazad, but Pastor Babinazad is the Muslim coordinator for the Seventh-day Adventist Church for the Pacific Union Conference. And sometime back, I personally, and I know many of you also, have a great burden for the 1040. There are so many people that have not yet heard the beautiful message that God gave the gift of life through his son Jesus. And what a beautiful time to give that message then at Christmas time. So Pastor Babinazad, working with Pastor Babinazad, we've come up with a plan, and by God's grace, as of yesterday, brothers and sisters, as of yesterday, we now have a Muslim center, a Muslim follow-up health information center where our patients, again, these refugees, we have thousands upon thousands from Sudan, from Iraq, from Iran, from Saudi Arabia, many other countries, lots and lots and lots of refugees. We have a health information center follow-up church as of yesterday that will be able to continue to follow and continue to provide whole person healing, again with the assistance of the God Pods, providing ongoing physical, mental, emotional, and eventually spiritual health to them. So again, trust, pray, obey in unified effort, and what a blessing, what an exciting blessing to see what God has in store for each of us in only 3 weeks. I would ask you to, all of you, continue to earnestly pray. Join us in praying every day at 6 p.m., all of us together as a group, praying that Jesus will move that mighty arm and that thousands upon thousands will hear his wonderful message of love physically, mentally, emotionally, and spiritually at Christmas.
Amen.
Again, there's no truth revealed more powerful than that which is made manifest in works of mercy to those who need our sympathy and aid. And our theme this year for Pathway Phoenix is the greatest of these, love. And I have to say another little tidbit that Hadassah, my 15-year-old daughter, came up with the theme for this year's Pathway Phoenix. And I think there is no better theme than to giving the gospel message at Christmas, the greatest of these, love. Christ's love to us. He demonstrates his love to the world. Why are we doing this? Because we want to be a part of demonstrating that love. We want to continue to offer ongoing awareness of whole person health in Jesus, and that will take place through our health information centers, which are ongoing. We won't have time to talk about that tonight. We talked about that in the last seminar, and we will talk about that in upcoming events as well. But along those lines, why we're doing this is to demonstrate God's love to the world. Department heads, all volunteers, I'm making a great plea to you. Our goal to be able to demonstrate this love to the world is to require maximal number of patients to be serviced. That means all of us working together strategically, thinking about how we can maximally get through as many patients as possible, because every patient that comes to the door is one more person that we can put in contact with the great God who loves each and every one of them. And if they don't make it through the door, we won't have that opportunity. God may still in his providence provide that opportunity, but what an awesome experience for us to be able to be participating in that. So I want to encourage you, whatever you have to do, department heads, listen to your directors. Increase your number of volunteers in your departments. Don't limit them. Unfortunately, many volunteers will not be able to come. Plan, at least 20% or so won't be able to come. Encourage all volunteers. This is a shout out to all of you. All patients should be encouraged to go by laboratory services. Every patient, when they go to lab, they will be assigned a health information center, and those patients will get their labs at the health information center, which are varied Seventh-day Adventist churches throughout the city and area of Phoenix, and sometimes all around the state. They will then continue to be allowed to encourage to continue in knowledge of physical, mental, emotional, and whole person spiritual healing. So I want to encourage all of you, maximal number of patients, one service per patient, not dental and eye care, one or the other. Depending on what we announce to you that day, we may be able to give all patients medical as well, but we will keep you posted. Again, the goal is maximal number of patient service. Department heads, even if you have to rotate the volunteers through, so that sometimes volunteers get tired. We all get tired. Give them breaks, rotate them through, but think about that as you're thinking about your numbers for your department. Okay, the next thing we want to talk about is being accepting. What an awesome opportunity to be Jesus' representation of love at Christmas. But we've got to remember to be non-judgmental. We've got to be accepting and loving of everyone. I want to encourage you in John 10:16. Jesus says, I have other sheep that are not of this sheep pen. Whatever pen we happen to be in, Jesus is saying he's got sheep outside of our pen. Don't be afraid to share. He loves them. He loves everybody in the world. He's calling them to. They too will listen to my voice, and there shall be one flock and one shepherd. I want to tell you a quick story to demonstrate the necessity, the absolute necessity of being accepting to all people, because we don't know whose heart Jesus is working on. It was the very first event in San Francisco, and we ended up, as many of you know, at the Armory, which ended up being on the other side of the Armory was actually an adult film studio. It was where God told us to be. These were the bouncers. A couple of those guys were the bouncers for the adult film studio. But God, in his providence, planned for that event to be right there so that these people could know and could see his love. Well, unfortunately, one of our volunteers had noticed that there was a lady that wasn't dressed like her. She looked different than her. And she probably had a very different lifestyle than our volunteer did. And she called out to the volunteer, who happened to be a woman, are you a man or a woman? What are you? It broke this individual's heart. She was actually one of the workers for this facility that was on the other side of the Armory. It broke her heart. She started crying and saying, she came up to me, she and several others, why would they say that to me? Well, we don't want to do that. We want to be accepting and loving and open, just as Jesus was to all people, because we don't know who Jesus is working on. He's working on all people's hearts, and we want to be considerate and loving to everyone. We've already talked about planning for at least a 20% no-show. Hopefully, this time around, we will have a 0% no-show. But again, department heads, plan for maximal numbers of patients and figure ways that you can accommodate that, because it's just one more person that we can acquaint with Jesus. I want to encourage all of you, if you know anyone who has not yet registered, please help us in that regard. If you are not registered, you will not have a badge. If you do not have a badge, you will not be allowed on the floor of the convention center. And we want you and your family and your friends and everyone to have the opportunity of volunteering this Christmas. We want all of us to be able to be the Christmas gift and participate in giving the love of Jesus to everyone. I just want to remind all of you, several questions have come in as far as malpractice is concerned. Ms. Hadassah, could you shut my door? I'm getting feedback. If you don't mind, if you could come shut the door, that would be really helpful. We do have a medical malpractice coverage that's a $10 million coverage. Everyone participating in the event is covered by Medi-Mal coverage at a 10-10 policy. But it's important to note that that is only for 3 days, the 3 days of the actual event. Actually, it covers the 24th as well, which is the pre-screening. So it covers the 24th pre-screening, any pre-screening, pre-surgical cases that we may do, the 25th, 26th, and the 27th. If you are planning locally, and I'm speaking to the local health information centers right now, if you are planning on having continued follow-up, which I highly encourage at the health information centers as far as continued physical follow-up, you will need to ensure that your providers who are helping you in that area, and Cheryl Lindemann will be helping to instruct you in this regard, as well as Dr. Ugana Woods, they must have malpractice coverage. They can call their primary malpractice carrier, which is what I've done. You can call your primary malpractice carrier and ask the carrier to add you on to add the follow-up to your policy. But it's imperative that that takes place. We obviously have medical follow-up. We're not going to belabor that. Pathway requirements, we went over that last time as well, but again, we've already mentioned you've got to be registered. You have to have your badge on at all times. Security will not allow you again on the floor if you do not have a badge. And then you must follow the appropriate chain of command. We will not be going over the chain of command tonight. We have so many other amazing things we want to get through. That will be in the second to the last webinar training that we will do. We'll talk about the chain of command. We will also talk about it at the final training session at the Convention Center on the night of the 24th. Pathway Phoenix goals. We talked about this before. We are on target. We are planning to hit 8,000 patients, God willing. We are expecting 3,200 volunteers by Christmas. So I believe we are more than on target. We are adding conscious/IV sedation that will allow us to do a lot more procedures with more comfort. To date, we've been doing many of these procedures, but they haven't been so comfortable for the patients, particularly cystoscopy and hysteroscopy, scopes of the uterus and scopes of the bladder. We are adding endoscopy, specifically upper and lower esophageal gastric visualization, and also colonoscopy, and a few other things as well. We've already talked about the exciting refugee assistance. I want to encourage our local people. Right now, I'm talking to the local health information centers. For those of you who have yet to meet with Pastor Glenn Santana, if you are ministering to the refugees in one capacity or another, you please must connect with Pastor Santana. We need to get the flyers, the patient flyers, in all the various languages. So please, please talk to Pastor Santana and also our language experts, department head for language, and make sure that those flyers are available. We will be having the Muslim in Arabic and Farsi flyers within the next week or thereabouts. Okay, we've already mentioned the amazing miracle of the meals. I just want to update you again as far as the meals, make it very clear. More questions have come in this regard. You will be having a lunch meal provided to you and the patients entirely free. All meals are plant-based. They're very healthy. They're inexpensive because we have to keep it that way. As we all know, we're on an extremely tight budget, but they're healthy, they're plant-based, and they'll give you the energy to get through the day. The evening meals, this is where the absolute miracle of God has just taken the house down. December 24, 25, and 26, we are very, very, very pleased and very excited to be offering our volunteers a meal, a dinner meal, a very nice dinner meal for $6 a meal. I would ask you, each of you, at such a low price, this is like Taco Bell prices, guys, but this is banquet style dinner. You will be served an unbelievable meal. Dr. Bob Gadd, who's in charge of our meals, is phenomenal. You will be absolutely ecstatic for $6 for your banquet meal. I would ask you to consider, please pray. Look what God has done for us with all the miracles of the meals and the accommodations and unbelievable things. I would ask each of us to consider sponsoring. If you have 4 people in your family that's going to buy meals, consider sponsoring a patient, 2 patients, 3 patients, 5 patients, whatever the case may be, for $6 a meal. The goal is, by God's grace, to invite our patients, all of our patients, to the dinner meal where they will be presented the gospel in simple form. It's going to be beautiful. Again, Christmas night, December 25 and 26, Christmas extravaganza, patients, doctors, dentists, plumbers, electricians, all of us children sitting down at banquet style tables together, eating together, and hearing the beauty of God's gift of love through his son, Jesus. If you would like to purchase, let me go back one information. As far as the purchasing of the meals, expect a notice from Susanna Facundo, my administrative assistant, this week. When you receive that, you'll be able to go to a link on the website and purchase your meals, and also, by God's grace, sponsor a patient or several patients. I want to talk to you just a few minutes as far as the uniforms are concerned. You should have received a notice that you can purchase additional shirts now and through the 29th. So just a few more days to purchase your additional shirts for your department. Again, every volunteer will be loaned 1 shirt per person. Again, it's a 3-day event. We talked about last time the ways that people have been able to utilize that shirt several days over. Washing it in the room works very well. It dries very quickly. Other people prefer to purchase another or at least 1 or 2 shirts. Other people wear a shirt underneath in addition, and then wash it in their room. But you will need to return that 1 borrowed shirt unless, of course, you decide to buy 3 or buy 1 or whatever the case may be. Of course, you can keep your own. Any shirts that you buy, you can, of course, keep. Every department has a designated color. All of that information is on the website, and you'll be able to determine which department you've been assigned to and then which shirt color would correspond with that. If you can't figure it out, it's not a concern. It will be determined on the other end. You just need to make the purchase of your shirt online. Again, for the rest of the attire, we do ask all people to dress, our volunteers, to remember that we're Christians, we're professional. We want to look like a hospital on wheels, which is exactly what we are. To dress modestly and appropriately. Please, no jeans or shorts. Ladies, skirts or slacks. Again, colors are tan, blue, navy blue, or black. Tan, black, navy blue. Again, for gentlemen, as far as slacks are concerned, and we already talked about the pathway shirts. The children's program. The children will also be provided shirts that they will wear for their daily meetings. Again, you can purchase an additional t-shirt for the children as well if you would like. They will be having meetings running throughout the day. So for children ages 0 to 12, the children will have meetings throughout the day. The volunteer children, and many people have asked questions about this, are entirely separate from the patient children. So there's many reasons for that, one of which is the patient children are only there for a very short period of time. So obviously the volunteer children, they too get to be little missionaries. Don't worry that your kids are not getting to experience the mission event. They are going to be wrapping presents. They're going to make crafts. They're going to wrap them up. Claire Diaz is unbelievable. I trust her with my children. She's had all 4 of my children in classes, and she's amazing. So you can be assured she's overseeing all the children's departments for the volunteers. It's going to be an amazing program. But the children will be making crafts. They'll get to wrap those. They'll get to bring those down to the patients. They'll be coming down and singing for the patients. They'll be bringing little presents and tracts down. They will get to be able to be the distribution for the toys for tots as well. So the kids are going to have a role to play. We just want them to be in a safe environment. In the evenings, for the evening meeting time, and we'll talk about the times in just a few minutes, there will be a children group running as well in the evening for 0 to 12-year-olds, and then a youth meeting for 12 to 18-year-olds, and then of course the general meeting. If you would prefer, or your children would prefer to be with you in the general meeting, by all means, by all means. So whichever is preferential to you as parents, and the children is fine, but we do want to offer that because some of the young people have been asking for a youth meeting to talk about ways that they can continue to be missionaries as well. At this time, I want to ask Mr. Gilbert, Mr. George Gilbert again, who is our Chief Operating Officer, if you wouldn't mind talking to us a little bit about the logistics of the event. This is the Phoenix Convention Center and the roads. You want to tell us anything about this slide?
Yeah, with regards to this slide, the convention center is south of the I-10, and we go to the next slide. You can GPS it on your GPS. It will be, the address is 100 North 3rd Street, and that's in Phoenix. Now, if you'll take a look at this picture, this is 3rd Street right down the middle. You have the west building on the right and the north building on the left. The event will be held in the north building. However, the children's meetings will all be held in the west building, which is across 3rd Street. We can go down to the next slide. The convention center on the north building is separated into actually 4 layers, 3 upper floors and then the lower level. We are going to be having the event in the lower level. There's actually 312,000 square feet in that lower level. Next slide, please. This is the layout of, well, not the layout, this is the overview of that particular hall, 312,000 square feet. The event will be held in this hall, hall number 3, 4, 5, and 6. The meetings will be held in halls 1 and 2. Next slide, please. This particular slide is of the children's meeting hall in the west building. The children will be in rooms 101A, B, C, 102A, and B. We will not use the rest of these buildings, just those on the left side, 101A, B, C, and 102A and B. They are in the west building, street level. Next slide, please. This is the actual event hall itself, and we have the setup. I know it's very small because the event hall is very big, and we are putting this on an 8.5 by 11 sheet of paper. Consequently, it is quite small. But going down from the main hall, as you come in from the building, you'll come into the building from 3rd Street, and the building itself is on the east side of 3rd Street. You will come down the escalators, and when you get into the lower level, there will be queues for dentistry on your right as you come down, queuing for dentistry cleaning and dentistry, other necessities. Dentals will go on in, and this will be the medical portion of dental triage, and then the waiting area, and then the actual dental triage itself, dental x-ray, and then the waiting for treatment, and then actual treatment into the rear, which is actually the north end of the building. And then as far as all of our sterilization and supplies are in that cubicle there. And then whatever a person might want, whether it be hydrotherapy massage or possibly beauty barber salon down in the lower right-hand corner, etc. And of course, this will all be escorted around by the folks, the PAT folks, as they will escort the patients to their various functions. Also, we have mental health in the upper right corner. We have eye care just below mental health. We have hydrotherapy and central supply. As you go down, you get into the medical area. As you enter the medical area, you have cardiology, etc., all of the various specialties. On the right-hand side of your screen, you get into the surgical area, whether it be ortho or general surgery itself or plastic or whatever, GI. And in the lower right-hand corner is women's health. Over on the left-hand side of the main aisle, which would be the lower left-hand side, you get into podiatry and radiology at the very back. And then you have primary care above that, a pharmacy, etc. Now, as far as the patients are concerned, those patients who are not dental, if they're optical, they will be admitted into optical, registered into optical in the main lobby, and then taken over through hall 4 door on the north side. Those folks who are medical patients, they will go to the medical side, which would be just to the, on your picture there, to the right of the optical registration, and they will then be taken with the help of the PAT folks into the hall where they will be done medical triage, and then the optical will go into optical triage. And again, optical goes into the eye care area, medical will be taken down into the medical area for whatever reason they might need. And then everyone, this is very important, everyone goes through lifestyle and then out through by the chaplaincy area. And we have tables for literature, etc. And then they go through exit management where their information is kept and copied for the patient. And then their patients then exit a hall 5 door, go out the escalator, back up onto the street level, and there they go out the street main door, similar to the doors that next to the doors that they came in. All patients will be in queues out on the street level. Can we go back to the picture of 3rd Street, if that's possible? Back to the picture of 3rd Street. There, go back, there we go, 3rd Street. I don't know if you can see my cursor or not, but on the left-hand side where you see that overhead walk, that is exactly where the center of the building, and also the entry doors are at. To the rear of that, to the back of the picture, is where optical and medical, let's go back to the picture. Optical and medical will be queued up. To the forward portion of this picture is where the dental and dental cleaning will be queued up. Now then, we can go back to the slides. Okay, next slide, please. Next slide, please. We're going to be having set up, back to the time. We're going to be having set up on Friday and Sunday. We are allowed to set up in the event hall, in one hall, hall 6, on Friday, December 22nd. I would like folks, if they're interested in helping, to be available at 9 a.m. What I would like you to do is to enter the main entrance underneath that overhead walk, go down the escalator because the elevators, because the escalators will be closed off, go down the escalators to the lower level. There you will enter into hall 6, into the main doors of hall 6 at approximately 9 a.m. if you would like to help. On Sunday is the main setup day. At that time, we're asking folks who would like to help us show up at 6 a.m. and we are going to be divided into various groups doing various many functions. We have supplies to unload, equipment to unload and distribute, tables and chairs to distribute, as well as the pipe and drape to assemble, signage, etc. And then on December 27th, and this is very important because it can cost us about 20% of what the whole cost of the event if we don't get it done by midnight on the 27th, as that's far as tear down is concerned. We will begin tearing down as soon as registration, as soon as registration and so forth are finished. However, we will not disturb any treatment. It will be a phased out beginning of the tear down. After the last patient is out, then we will completely have everyone who is under the age of 16 leave the building so that we can tear it completely down and load our trucks. I would like to mention that with regards to setup, whether it be on Friday, Saturday, or tear down on Wednesday, no one is allowed into the event hall. That's not the lobby, that's not the rest of the convention center, but into the event hall of who is under 16 years of age. This is the convention rule. Thank you very much.
Thank you, Mr. Gilbert. So let's continue then. We just have a few more slides, and I want to open it up for questions. Patient assistant transport. All patients, again, must have an accompaniment. Please make sure if you're part of the PAT team that is taken care of. We've talked about last time the emergency response team. Again, do not call 911. We'll be talking about this more later, but we do have an in-house emergency response team, and they will be taking care of any emergencies that may incur. We, again, have an in-house formulary for all of the providers. Please do not write any prescriptions, even if you're licensed in the state of Arizona permanently and have a practice. Please do not write any outside prescriptions. We need everyone to use the in-house formulary. We have a great formulary, and you'll be able to see that ahead of time. But again, we ask that you not do any outside medications. This is a sample of a surgical consent and procedure form previously done. Again, the surgery department will have already been talking to many of you, and we can discuss that later as well. These are samples of in-house referral forms. Again, these are provided so that all provider and all volunteers know what services are being available and offered as opportunities. This is a referral service. These are outside agencies where patients are being referred and can be referred to. Again, this is from Pathway Los Angeles, but something similar will take place for Pathway Phoenix as well. It is very important, department heads, I'm speaking to all of you right now, that you provide a list of follow-up clinics and supporting agencies from 1 week from today. So again, I ask that you please I ask that you please provide that as soon as possible. We need to have that no later than 1 week from today. Communication protocol, we talked about this last time as well, but again, no cameras and no photos of patients. You can have a camera, obviously, it's on all your phones, but please do not take any pictures of patients. All press and social media and literature distribution is taken care of by our communication department. And again, following the appropriate chain of command is imperative to making sure that we have an appropriate presentation to the city. It's really important to note that we will have massive media publicity. We have in the past, and I'm expecting the same again this time around. And we want to make sure, again, for the same reasons we've already talked about, we have a very professional Christian appearance, and so it's very important that we follow the appropriate communication protocol and chain of command. Many of you have asked how is advertising taking place. 500,000 patient flyers are being printed right now by Ben Franklin Press. I cannot thank Ben Franklin Press enough for everything that you have done. They have been unbelievable. They're a Seventh-day Adventist printing press here in the Phoenix area and have done all of our printing. We want to thank them. They are also doing the printing for the 500,000 patient flyers. We are going to need about 2,000 local people. This is a shout out to all the locals right now. I'm a Phoenician and I'm local too. So this is a shout out to all of you. December 9, 16, and 23, Sabbath afternoons. These are the 3 designated Sabbaths that the conference has designated for days that we will be distributing the 500,000 flyers. We may need more time. If you all want to go out on different days in addition, by all means, go for it. Please plan to touch bases with Dr. Woods and Pastor John Sackinger from the conference to make sure that these flyers get out. We also have posters that will need to get out to the various grocery stores and different locations where patients are tend to congregate. We want to make sure that the word gets out. Statistically, over and over again, we've seen in all the cities that we've gone to, the best response has been from the flyers. We are also putting ads on buses, billboards. We've done that in every city we've gone to. And then just before the event, our head of communication, Costin Jordash, and working with the local government, will be putting out press releases. So we're looking forward to all of these. This is a sample of a previous bus ad that we've had on the inside of buses. Languages, I've already mentioned that, but again, if you are one of the language group HICs, right now the flyers are only going to be printed in Spanish and English. However, we have a lot of emphasis, obviously, in our refugee ministries, and we want to make sure that these various groups get represented. And so I would ask that if you haven't yet touched bases with Pastor Glenn Santana, that you do so immediately, so we can make sure and get the flyers, in all the various languages. Okay, these are samples of the various health information centers from Los Angeles. We have actually, I believe it's about 27 health information centers throughout the state of Arizona. And so this is a sample of what will be provided to the various patients as well. The hours of operation we've talked about several times. We're going to go through that right now at a week at a glance. On December 24, which is Sunday, the date of the official setup, although we heard from Mr. Gilbert, December 22 will also be a setup day. December 24, we asked that, or Mr. Gilbert's asked that by 6 a.m. the pipe and drape crew is there to set up. If he's asked you to come earlier, if you're part of the team that's coming earlier, then you will have been notified. 10 a.m. is when volunteer registration will open up. We're planning right now for 12 o'clock actually for the regular department setup. We may move that earlier depending on how things are progressing with the general setup. By 5 p.m., each department should be having its final department meeting to give basically the final instructions for your individual department. Department heads, please plan that this meeting is let out entirely so that the volunteers can get over to the general training area, which is just right there on the same hall. But they need to go into the convention room for the mandatory final general training session at 5:45. Then this is the exciting part. This is the Christmas Eve. We've all worked really hard on Christmas Eve, and now we get to celebrate with a wonderful supper, an evening meal, Christmas music, amazing presentations, and you're not going to want to miss that Christmas Eve program. Again, dinner is $6 a meal, but it's banquet style, and you're going to love it. You'll be having the meeting right over your dinner, so it'll be just a wonderful Christmas celebration. Then on December 25 and 26, Monday and Tuesday, all volunteers are asked to arrive at the event by 6 a.m. I know that's early, unless your department head tells you otherwise. So again, 6 a.m. is when we need volunteers to be at the event, because the first patients will be through the doors officially by 7 a.m. Some of them will probably be in before that. 6:30 p.m. is the evening meal. Again, that's for patients and volunteers. This is a wonderful, exciting banquet. Again, $6 a meal. And for those of you, again, I want to ask all of us to consider sponsoring a patient so that all the patients, if they desire, can come to a banquet-style Christmas night dinner, and also on the night of the 26th. On 7 p.m., the evening meeting at the convention center will officially start. We will start to let people through the doors at 6:30, but again, the meeting will be right while you're eating. So it'll be just a wonderful, exciting Christmas banquet program. Many have asked, what do we wear to this Christmas banquet, and why is it 6:30? Well, it also gives you a little time between when the clinic ends to get back to your room and change and whatever else you want to do. Wear what you'd like, but just remember, again, we still want to look professional and Christian, and just a wonderful opportunity, because we will be inviting the media as well, particularly on December 26th. December 26th is what we call the Christmas Extravaganza Gratitude Session. This is where we're publicly recognizing and thanking the wonderful dignitaries and all these various businessmen and women who've come together to help all of us collaborating together to be able to provide this wonderful whole person care to our patients over the Christmas holiday. So we are just very excited about that. You are not going to want to miss these programs. Again, there's a meal. It's an amazing program. The children's program will be running consecutively with the adult program if you so choose. December 27, again, same start time as Mr. Gilbert already mentioned. The goal is by 1 p.m. to have the last patient serviced, and then to be done by inventory and a breakdown by midnight. At 7 p.m., for those of you, I know many of you are attending the GYC programming. We want to encourage you to do so, but don't forget those of us who are still breaking down. So we're very excited to be the pre-conference for the GYC programs. We want everyone that wants to go to definitely make it to their programming. We still need a lot more volunteers in specific areas. We need about another 250 or more people to help us set up and take down, and about 100 more in venue services. Without venue services, I can guarantee you there will be no event. You will not have exam rooms, you will not have anything. So we want to encourage all of you to please participate and help with at least the setup and takedown. There's another area where we need some more help, and that's in decorations. Anna Burris is a professional design decorator, and she needs about another 40 people to help, specifically with collecting supplies ahead of time, borrowing plants and trees. It sounds strange. We've done it in every city we've gone to, and we've been able to keep the budget down. So basically what you do under the direction of Anna, working with Anna, and I'll be there as well to answer any questions locally, going to Home Depot, Walmart, Lowe's, etc., even Michael's in different locations, and asking for borrowed plants, trees, etc. And then we borrow them the flowers and utilize them, and then bring them back after the event. Anna is asking that.
And we've never had a Christmas event before either, so we need Christmas decorations since it's Christmas.
That's correct. And Anna is again, Anna is in charge. She's already come up with a plan. So you just need to indicate that you will be interested and available to help with decorations. But please, it all needs to be under the direction of Anna. Anna has a whole decoration plan, and we actually had the opportunity of meeting this week. She has a great plan. 1 week prior to the event, Anna is asking that people come together, anyone willing and able to help her to begin to assemble the decorations. She's not going to have a lot of time because, as we know, set up at the actual event, we're not allowing officially at this point until noon. And so Anna only has about 5 hours to get everything set up, because we'll be going live. The evening meetings will be live. They will be broadcast around the world on Adventist World Radio, Hope Church, and YouTube and Facebook Live. So this will, and other social media. So This is going to be a lot of work in a very short period of time. And so Anna is asking anyone who's available to meet with her 1 week before the event and begin to put all the decorations together. And then in the meantime, if you're interested, I would ask that you would all email Susanna Ficundo, and that's through the website, with your interest or your availability to help Anna with decorations. Volunteer needs, still need, again, the venue services we've mentioned strongly. I need another at least 200 plus people and another 300 to help with setup and takedown. Need 75 or more in food service. Again, that's taking place because of the new requirements which we're so blessed to have to be able to prepare our food right there on site. But we are going to need about 75 more in food service. So if you know anybody that you can encourage to come, please encourage them to do so. We are still in, this is the one that I must admit is still a desperate need. We desperately need optometrists and ophthalmologists, and this is what I would ask. Locally, I'm speaking to my local people right now, and even our distance people. We need to have people going out to Lee Optical and other optometry locations and ask and provide them with invitations, even if the optometrist can only volunteer for a few hours. So I would ask again, if there's any of you out there that are interested that could potentially help in any way, shape, or form, we desperately need more optometrists and ophthalmologists. So if that is of interest to you, please reach out to Dr. Woods or myself specifically. We need more dentists and dental hygienists. We can never have enough of those. We definitely need more of those. We do not have an ear, nose, and throat specialist. We need an ENT. We need another dermatologist and a urologist. And any other medical professionals. We still need more medical professionals. Laboratory services is another area that we're working through. I believe God's working that one out. We have 3 different angles that we're working, but I would ask that you would please pray about laboratory services, that we'll get that resolved this week. God's also answered our prayer requests as far as radiology equipment. It looks like we're going to have all the portable x-ray units, mammography, and maybe even a CT scanner. Echocardiogram is still an issue, and so that is still a need. I'm calling out to all of our hospitals and collaborative entities and individuals with connections on the call right now. We still need an echo machine. Supplies, we are still in need of specific supplies. I would ask that Cheryl Lindemann and Dr. Linda Gilbert provide us with a list through Susanna Facundo to send out specifically what we need for supplies and see if some of our volunteers can help to pull together some of those supplies. We've done that in past events and it's been able to significantly decrease our cost, in addition to reaching out to the hospitals, etc. We're also in need of more tables and chairs, so if anybody wants to donate towards that, either fiscally with dollar figures or actually loaning us, that would be very, very beneficial. Still don't have enough in-kind donations, so we talked about that last time. Donation packets are again available through Pastor John Sackinger at the Arizona Conference. At this time, I am going to close with prayer and then we're going to open up for question and answer. But I just want to thank each and every one of you for joining in this great endeavor. God is doing some very, very, very exciting things. And I would encourage all of us, please remember, we can't limit God. Mr. Mellon has been sending me little texts every day. Don't limit God. Don't tell him, oh, we only want 8,000 patients. Say, God, we want as many as you can give us. Give us as many volunteers as you can give us. Give us the people so that we can share your love with them. So we want to trust, pray, obey his command of the Great Gospel Commission and unified effort. So with that, I'm going to close with prayer. Dear Father in heaven, I want to thank you for each and every one of our volunteers. Thank you so much for them and giving of their Christmas. We're not giving up our Christmas. We're actually being able to be the gift of Christmas this year. Thank you for allowing us that privilege. We ask that you would please provide the needs that we still need. We still need laboratory services. Thank you for providing that ahead of time. We still need more volunteers, specifically in optometry and dental and medical. We ask that you would provide those for the venue services and the food, and we thank you ahead of time for all those that you're going to bring in. And thank you for providing us with the supplies and everything else that we need. You know what we need more than we do. Thank you ahead of time for what amazing miracles you're going to bring about. In Jesus' name I pray, amen. Okay, at this time, I'm going to open it up to questions. I am not seeing questions for some reason. Hadassah, if you can read me the questions, for some reason, I'm not seeing any on my screen.
Oh, I don't see any either.
Where's the question?
Are there any questions, Hadassah, that you see on your screen? Hello? Hadassah. Okay. All right. Well, give me 1/2 a second and find out if she sees anything on her screen.
While we're waiting, I would like to say thank you to those of you who have donated either the $25 or we've had even hundreds of dollars, thousands of dollars. We just want to thank you for the donations, which are going to help us be able to conduct this event. We still do not have all of the money that we need, but it has certainly helped for the donations that have come in from our volunteers.
So at this time, we're right on target at 8 o'clock. We will be actually taking your questions at the next webinar. Our next webinar is only going to be a 30-minute webinar, and the rest of the webinar will be open for question and answer. We don't want to keep anybody any later than we already are. But I again want to thank each and every one of you for joining us. I want to encourage you, please, 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 go out and get anybody you know who has not yet registered and tell them please to register. It is absolutely important. Okay, thank you so much. God bless you. Please remember, let's all trust, pray, obey, and let's not limit God, in the words of Mr. Mellon. God bless and have a good night. Thank you so much.